Chapter 16, Part 2, we let off talking about amniotic fluid. It's really crucial that this is a kind of anymore last choice because there's a high risk of miscarriage associated with it. Synovial fluid, this is the fluid within the joints. Important to identify infectious arthritis from non-infectious arthritis. Removal of fluid by the physician for the synovial joint is called arthrocentesis. The fluid transported promptly to the laboratory at room temperature, and again needs to be protected from light. There's also, we could collect fluid from around the lungs, pericardial fluid from the heart cavity, and fluid from the abdomen as well. Culture specimens, we're going to cover sputum, throat swabs, sinus drainage, wound tissue, ear and eye cultures, and skin scrapings. A buccal swab is a sample from a cheek or mouth of the patient. It involves swabbing the inside of the patient's cheek with a special swab. It's a non-invasive way to detect DNA samples for testing or paternity testing. Sputum collection. This is fluid from the lungs containing pus. It's collected in a sterile container, which looks like this. For microbiology specimens, the test for pathogenic microorganisms, including tuberculosis, can be collected in containers with a preservative for cytological testing, and caution is needed in collection and transportation process because there is a preservative down at the bottom that is poisonous. Proper identification and inform the patient of the collection procedure. Wash hands, put on gloves, lab coat, and facial mask. We need the fresh, early morning specimen resulting from a deep cough for diagnosing the infection. The container must be free from external contaminants. Wearing gloves and PPE required by the facility, and transport labeled container to the laboratory. Deliver specimens to the laboratory immediately. Nasopharyngeal culture collection. This could be for Neisseria meningitis, Streptococcus pyogenes, H. pylori, influenza, and Staphylococcus aureus. For infants and children with whom significant sputum cultures are difficult to obtain, the nasopharyngeal culture may be used to diagnose whooping cough, croup, and pneumonia. This is basically going back and basically touching the back of the nasal wall, which is very uncomfortable. This is also how they're currently collecting samples for COVID-19. The throat swab collection to determine presence of streptococcal infection, also referred to as strep throat, is collected by either screening method or microbiology culture. So the technician will use a tongue depressor, ask the patient to tilt their head back, and they're going to swab areas that look pus-like, red, white, and they're going to do it in a figure 8 pattern in the mouth to collect. We want to avoid collecting the swab from the cheek or the tongue. We're going to instruct the patient to open his or her mouth wide as if to yawn, direct the light source into the mouth and throat, and using a sterile swab, we're going to swab the tonsillar areas, back of the throat, and areas of inflammation, redness, white pockets of pus, and or ulcerations. You're going to place the swab in a special transport medium or inoculate the fluid on the swab directly into an agar in a petri dish by rolling the swab. Generally, this is collected a lot of times as a dual tip swab, so one can go to microbiology and one could be used for rapid strep screening tests directly from the throat swab itself. Again, we've already discussed that the container must be free from external contaminants. If transportation to the lab is delayed, we must refrigerate the specimen until transportation is available. Culture specimens, there's skin testing, allergy skin tests performed in patient's forearm or back using a common procedure called the prick technique. This would basically mean they do a small amount of the allergen onto the skin, and then we look to see if the welt increases in size. Generally, if the welt is large, red, and more than 20 millimeters in size, that is a positive allergy test for that specific antigen. So this could be grass, dairy, peanuts, tree nuts, what have you. The TB skin test, it's not one that phlebotomist performs, but it's just something to review. It's administered under an automatic device or by pulling 0.0 mLs of diluted antigen into the syringe and holding the syringe at approximately 15 degrees. And then they are going to pull the plunger back slightly to ensure the blood vessel is not entered and slowly expel fluid into the skin. And then this is where they'd go back to report any reactions, no matter how slight, to the physician and schedule a return. So anything that's really red and raised would be a positive. Anything flat with no color change would be negative. Gastric analysis performed by a nurse or physician is to determine how much acid is produced in an individual's stomach. The stomach gastric contents are emptied through a gastric tube, so it's basically passed through the nose and down into the stomach. Gastric analysis, the healthcare worker can be present to assist in the patient care, but not under any circumstance should be expected to carry out the procedure unless properly trained. The healthcare worker can and should be responsible for proper labeling of gastric and blood samples collected when he or she is present and assisting during the procedure. Breath analysis for peptic ulcers. Helicobacter pylori is a bacteria that damages the stomach or intestinal lining, is linked to ulcers and stomach cancers. A positive H. pylori test, antibody antigen, or breath test indicates the patient has been infected with this organism. This could be done by measuring the breath hydrogen of the patient or be done via blood test. The sweat chloride test is screening, analysis, and diagnosis of cystic fibrosis. Patients with cystic fibrosis actually produce sweat chloride at 2 to 5 times the normal level. So HCl, hydrochloric acid, HCl, is interphased into the skin of the patient to stimulate sweat production. So the electrode drives the medicine into the skin. The sweat is collected on the filter paper. Sweat is tested for chloride concentration, and then a high chloride concentration is most likely due to the CFTR mutation. The sweat absorbed onto the pre-weighed gauze pad, then the weight of the sweat is determined. The pad is then diluted with deionized water, and the chloride is generally read by titration. This is performed in duplication. Again, there is a detailed chart, and that could be found under the specimen processing lab as well. It will say chapter 16 chart, and it basically takes all these lab tests and lays them on the chart for review. Please be aware the sweat chloride level is utilized for cystic fibrosis, but there is also now a blood test, and it's also included in the newborn's PKU screen as well. This concludes chapter 16, which covers the collection of urine and other bodily fluids in the lab.